Welcome back. If you're just joining us, we're talking with Teresa, and she had some unusual symptoms whenever she was pregnant, which turned out to be a brain tumor. And so please continue. So the doctor gave you three options: stroke, MS, or brain tumor, and you said you'd rather have a brain tumor.
Yes, so basically the MRI we went through, they were in there for 3 hours with me. Normally an MRI doesn't take more than an hour.
Right.
And I actually fell asleep in the MRI. They took so long. And my mom was out there with my child in the waiting room going, where is she? She's been in there forever.
Wait, let me back up. How did you fall asleep during an MRI?
You had to
Those are loud.
They gave me headphones with music, and I was just
It's
kicking
still
back and relaxing.
loud.
So I made them turn the music really
Okay,
loud.
I'm like, you can still hear. Okay.
No, and it was comfortable. I was just sitting there,
Okay.
and plus I was really tired. I think the night before of having
Right.
just the fatigue of not knowing and having to go through all this and being up with the baby. That it just kind of
Right.
was like, hey, this is my little quiet time area. Let's just go in here and we'll go in and see what's going on.
Right.
Well, when it came down to it after we did all our MRIs, they did them twice because they couldn't believe the tumor that I had. And they were really worried about it. They're like, you don't have any symptoms? And I went, well, I have numbness. And I have the hot and cold sensation. And they said, okay. And he says, Miss Zadansky, I have some pretty bad news. And I'm thinking, I'm going to die tomorrow. This is not good. And he says, you have a brain tumor. And I said, okay. And I'm smiling, and I have tears of joy running down my face because it wasn't multiple sclerosis, it wasn't anything else. And everybody goes, how can you feel this way? And I said, because I knew what it was. There was an honest answer. It was obviously on the MRI to tell me, Teresa, this is what's going on with you.
Now, when you actually found out you had it, what were your feelings towards the first doctor that just told you it was pregnancy related?
I was very upset. And it really got to me because I put all my trust, and I've learned not to put all my eggs in one basket. And that's something I learned to do. And I encourage more people to not just look at one doctor. Sometimes, if you have such symptoms like I was having, go to multiple doctors if you feel that you didn't find the answer and it did not work. I mean, I had 9 months to play with this.
Right.
And I should have, but I was a workaholic and I had other things that I thought were more pressing in my life. But I've learned, no, my life is more pressing than all the other things.
So the symptoms started at what month of your pregnancy?
It was in February. I got pregnant basically the last week of January.
And so it was almost immediate.
It was within 3 weeks.
Okay.
And then it's when it started, and then obviously the effects of it have not dissipated, and nor will they because of where the brain tumor lies.
Okay, what kind of brain tumor was it?
I had an acoustic schwannoma, which basically
I was going to say, please tell us what that is in layman's terms.
it's a CP, it's a cerebellum pontonal angle tumor, which is basically, it was pushing up my cerebellum, so I couldn't walk straight. And now when you see pregnant women, they tend to walk like this.
Right.
Well, I did the waddling, and I kept waddling. And I thought, oh, that's just from the pregnancy. Well, that wasn't from the pregnancy, that was also from the brain tumor, because I still waddle. And being heavy set, you wouldn't think as much of it. It was like, oh, I'm just a heavy set person. But no, it's from the brain tumor. So I tell people, it's not from me being bigger. And I tell my husband, I said, it's hard because sometimes I think I'm drunk, but I don't drink.
Right.
So it's like, what do you do? Well, I have people in my brain tumor support group who also have this kind of a tumor, and they have been told at workplaces they've had to have breathalyzer tests.
Wow.
They've had to go through all this, and you can have a tumor the size of a lima bean, or you can have a tumor the size of a lemon.
And how big was yours?
Mine was the size of a golf ball.
And it was benign, so if it's benign, it's such a risky surgery, why did they decide, or why did you decide to have it removed?
Because of the effects will not go away, and the tumor will grow larger. And they did not know it was benign until after you take that out of you. You do not know if a brain tumor is benign yet. In fact, most neurologists or neurosurgeons will tell you every tumor that's in your head is cancerous. Because I had abnormal cells that were combining together to make a mass. So technically, I had brain cancer, but it wasn't the kind that would warrant radiation or chemotherapy.
So what was the recovery period after you had it removed?
Well, from what the doctor said, 4 to 6 weeks.
Okay.
And
In reality?
I'm still recovering. And that's the hard part. Basically, when I woke up, I couldn't walk. I could not talk. My mouth was hanging down. And it was just a whirlwind of, oh my gosh, I'm deaf in my right ear.
Did the doctors tell you that any of this was going to happen?
Could. But said, don't worry. We had your hearing test done. We had an eye test done. Oh, you're fine. Don't worry. You'll be okay. And guess what? It all happened.
And so how did you react to all those things?
I was angry. Very angry. Angry at the doctors for not telling me. But the doctors didn't know when they went in there what they were going to find. It's kind of like you're at war. When you're going to go to war and you're trying to find the enemy, you're not sure where they're at, and you just kind of have to hunt and peck for them.
Right.
That's what they were doing with my tumor, is the hunt and pecking for all the little nerves to make sure that they could get through there and remove it safely without damaging all my nerves, so I could be here today to talk to you.
Right. So how did you learn to talk again, walk again?
Well, I went through intense therapy. Basically, I was in the hospital for 1 week. After 1 week, we had the choice to have me go home and try to get better, or send me to a rehab hospital. So my husband, which obviously I wasn't even rational making decisions at that point, he sent me to Warm Springs Rehab Hospital. And that became my new home for a month. And it was very hard.
So you lived there?
I was a patient,
Okay.
and I had to wear normal clothes. I didn't have to wear a hospital gown, and I had a wheelchair, walker, the whole 9 yards. And I went to therapy twice a day. I had speech, I had occupational, and I had physical.
So how were you able to communicate before you started going to rehab?
I basically slurred like you wouldn't believe, and you kind of went, what are you saying?
Did your husband understand you? Did your
Not
doctor?
really. I didn't even understand myself, and I heard voicemails I left to my husband on a cell phone. I was like, boy, I sound like I tied one over the night before. It was so bad. But people kind of went, after talking to me, they could hear and understand what I was saying. And I couldn't write.
Was it
So,
frustrating?
Very much
Knowing
so.
in your head what you're saying, or that you want to communicate, and then actually it not coming out, or
Oh,
not
yes.
sounding like you wanted to sound?
And your thoughts would be jumbled. And they still do that. I mean, for
Give
example.
us an example. I was just going
I
to
say, basically, I was talking to my son, and I said, oh, go put it over there by the bathroom. And he's like looking at me going, why would I put your flower pot of flowers that you have by your bedside in the bathroom? So I was like, no, I meant over there by the closet, which was the table there. Not knowing what I was saying. Or
Right.
say, oh, I love your pink pants. Okay, well those are pink, right? Well, I would say, oh, I love your teal colored pants. And I would think going, that's not teal, wait a minute, and then I had to learn to say the right word. And it was just the functionality of, I went to college. I feel this stupid. And just sitting with other people and having to learn to feed myself. Now, mind you, my daughter was only 2 months old. Couldn't hold her. My arms didn't work.
So how did you bond with your baby?
I didn't until she was 5 months old. It was very hard for me. And that was the hardest part, is I feel like I got robbed of 5 months of my daughter's life. I don't remember much. I remember they kind of just later with me, and I just kind of went, oh, look at her going, she has no clue who I am, because she got sent home and I'm still there.
Right.
So it was very hard. My girlfriend did take my daughter from me and loved her and took care of her just like I would have for over a month. And said, are you sure? Yeah, I'm going to go home with her. When I went home, I still couldn't walk, talk, was still getting there. And the occupational therapy was still pursued.
Mm-hmm.
And it took me, on my first anniversary of my wedding, I was able to walk. I walked like Frankenstein, but I did walk for my husband. That was his anniversary gift. So it was hard. And it was one of those, I'm a go-getter. I will achieve, I will overcome, throw it to me, and I will just pinch it and go for it. And I've learned that more so now with the brain tumor. And that took I try to help as many people as I can, because I never want anybody to feel like I did.
Teresa, we're going to be right back. We'll be right back.
For more information, contact the Brain Tumor Society at www.tbts.org or contact the Brain Tumor Foundation at www.braintumorfoundation.org.